Today we are demonstrating a central line dressing change. This should be done per facility policy, usually every 7 days or more often as needed. The infusion caps will also be changed. After you have verified the physician orders, gather appropriate equipment including 2 sets of clean gloves, well-fitting sterile gloves, a moisture-proof pad, new infusion caps, a central line dressing change kit, an antimicrobial patch if it is not included in your kit, a mask for you and the patient, 2x2 or 4x4 dressings, alcohol wipes, 10 ml normal saline flushes for each lumen of the central line. Once you have your supplies, identify the patient, explain the procedure, and provide privacy. Raise the head of the bed to a semi-Fowler's position and a comfortable working height. Wash your hands, apply clean gloves, and place a mask on the patient before placing a moisture-proof pad under the patient's arm. To remove the old dressing, stabilize the catheter with non-dominant hand. With dominant hand, lift the edge of the dressing beginning at the catheter hub and gently pull the dressing perpendicular to the skin towards the insertion site. Removing the dressing in this manner prevents catheter dislodgement in the event that the catheter sticks to the dressing. Remove antimicrobial patch and discard. Visually assess the area and make note of the centimeter location to assess for migration. At this point, remove your gloves and wash your hands. Open the dressing change kit while observing sterile technique and create a sterile field. Open the antimicrobial patch and drop it onto your sterile field. Apply sterile gloves. Clean the site with chlorhexidine solution swab in a back and forth pattern for 30 seconds. If your facility uses a betadine solution swab, use a circular pattern moving out from the insertion site, using a new swab for each pass. You need to clean the entire area that will be under the transparent dressing and allow it to air dry. Apply a new antimicrobial patch and sterile transparent dressing. Document the date and time the dressing was applied and initial on the external dressing. Remove gloves and mask and once again wash your hands. Apply clean gloves and place a 2x2 or 4x4 dressing under each needleless infusion cap. Open the normal saline and new needleless infusion caps and place the normal saline onto the cap, leaving the blunt cannula in the sterile package. Remove the old infusion caps and clean the end of the central line with alcohol. Attach the blunt end of the new infusion caps to the line. Check for blood return and flush the line with 10 ml of normal saline with a push-pause motion. When you are done, document the procedure and the patient's response in the patient's chart.